My name is Melita Emanuel-Carr. I'm 25 years old, and I was born and raised in London, in Westminster. In 2011, I believe it was, I was the first winner for the Champions of the Future Awards handed by Westminster. I then went on to play for the national team, representing England in the Commonwealth Games, winning silver. And I also went to America to play for 4 years, as well as receiving a criminal justice degree. And now I focus my time. I focus my time on basketball. So I'm a professional. So I play overseas.
Wow. Okay. So I know we've got together through Active Westminster in a sense, and I'm supporting a little bit of what people who are award winners can do as an osteopath in the practice in Maida Vale, where we are. But you had some questions specifically on different kind of sports injury related questions, which are more kind of general for people who are awards winners or anybody else, I guess, around who's listening or wants to watch and listen a little bit more about how to look after themselves, preventing injury, you know, supporting recovery, a bit about training, that kind of area. Is that fair to say? Yeah, that's the kind of questions you've got.
Right, exactly.
Great. Okay, well, far away. I'll do my best.
Okay, so I know a lot of people get niggles, so they feel like, oh, I'm hurting, but they're not sure if it's just fatigue or if they're just actually hurting. So what's the best way to treat it?
Well, the thing is, things, as you say, do creep up on you and you don't always feel symptoms to start with. Sometimes the first telling sign is actually your performance is changing, but you're not sure exactly why. It might come down, as you use the word, to fatigue, so you actually tire quicker. So the muscles are starting to contract up or not open up enough actually to maintain good function throughout a longer period of exercise. So there are little telltale signs that make you think, well, actually, that would be the thing to be looking at, to look at your performance before you start looking for pain. So don't sort of ignore performance changes, because in a high-level athlete, those things, those small differences in performance, you will detect if you put your mind to it and actually think them through. So where they start to occur, again, may not be preceded by pain, and it could be just a change in the angle, the change in accuracy in something like basketball, the change in speed. There'll be something like that that's another measure that you could actually start to sort of think, well, actually something isn't quite working. So it could be mechanical, and probably is to start with, where there's something that is not creating that flow or linkage between groups of muscles and groups of joints to deliver the speed and the accuracy and the flow of movement that you need to perform properly. So that would be my sort of thing to look out for, is performance first, and then obviously there's pain, but let's try and preempt that.
Okay, all right. Perfect.
Does that help a little bit?
Yeah, that actually does, because I know I tend to hurt a certain area or just have a little niggle, and either I ignore it because I think it will just go away, or I never think maybe it's the way I'm moving, why it's hurting, or it feels a bit odd. So yeah, that answers it perfectly. So when is the actual appropriate time to ice? Because I know watching, let's say, the NBA, they actually ice during the game. I've always been told to ice straight after practice. But when exactly is the appropriate time to ice?
When you're competing and when you're practicing, they're quite obviously different entities, you know, they're not the same sort of thing. So, you know, during high performance sports, you know, there will be perhaps shortcuts taken to get you back on and playing. So ice numbs, it's like an anesthetic, it takes pain away, and normally people put it on the bit that's hurt or hurting. Now, as an osteopath, I would tend to always look a little bit more around the area to see what's contributing towards that build-up of tension. It could be a direct knock or impact, of course, but it could also have come on from various tensions building up over time in your technique, in your training, that have caused that trouble. So, but obviously during a proper game, you haven't got time necessary to break that down. And part of this conversation we're having is also looking at prevention and looking at where there's breakdowns in function before things go wrong. Now, obviously in a fall or an injury, you know, things happen and knocks happen. So ice can take pain down. It can also reduce swelling, but it is an anesthetic, as I've said before, and therefore if you continue, you may cause more injury but not feel it. So there's always that danger with ice. The other part is over icing. that even after training, as you mentioned, you can actually chill the tissues for too long and actually almost freeze them. And what that does is it actually stops the circulation, the normal drainage and the normal inflammatory response and healing response can be inhibited by too much ice. So it's actually a fine balance. So icing is very much so, put ice on to a point for perhaps 6 minutes, they say roughly on average, take that off again, let it return back to normal skin temperature again, check it with your hand to see if it's still hot or whether it's actually sort of gone back to a more normal temperature, and then you can re-ice on several occasions, but always leaving quite a few minutes in between for the tissue to recover and the circulation around it to recover. Yeah, so that's the better practice if you're looking after yourself. But I get the point, obviously when people are competing, they may be told other things. You know,
yeah, I was just about to say, I think I've been doing it wrong all this time, because I've always been told ice for about 20 minutes after training.
Well, as I say, the research says, you know, icing for too long, repeated episodes, shorter episodes are better because it actually increases that sort of ebb and flow of the blood flow. You want to get the blood flow down, to cool it down, you let the blood flow come back in. It's almost like waves of blood flow. You cool it down, the blood goes away again, and actually you're flushing out the area that's being injured by those alternating cycles of cool and then room temperature again.
Okay.
So that would be a healthier option, I think, to choose.
Yeah. And when is the appropriate time to heat? Because I've always been very confused on this. I know before practice, sometimes I like to heat. Does it help during practice as well to maybe get a hot pack and kind of put it on somewhere that you feel a niggle or somewhere that's hurting? When is the right time for that?
To be honest, putting the heat on where it's actually hurting might be counterproductive. You often want to keep the bits warm that are the muscles that are acting on that particular joint. So if it was your knee, for example, it might be your mid-thigh or mid-hamstring, but quite a way away from the actual joint, because you want to make the muscles protect your body. Yeah, so muscles are there for power, yeah, and all the other things you need for the sport, but they're also there to protect you. And if they are actually in a state of cramp or spasm or shortened or tired or fatigued, the blood flow is reduced. And as a result, if you stimulate blood flow, you make the muscle work more efficiently. Yeah, does that make sense?
Yeah.
So that's kind of something to think about when it comes to you know, to balancing out that heat and the application of ice. But certainly heat is really good at calming muscle cramps down and increasing blood flow. So that's something perhaps for after the game. Some people do like to wrap or use something around the muscle to keep it warm whilst you're actually while you're actually training, and that just keeps that heat in to that area of the body that may be a bit vulnerable, and particularly the muscle going into cramp.
Okay.
So I think the watchword with all this is, if that's happening, you need to consider why that is, and that will be the thing to do in remedial looking at it, not just keep waiting for it to go wrong and put heat on all the time, because it says something isn't working right with your training, or something that where you're carrying an injury. And I think that's the you know, it's not to make you paranoid about it, but it means something's going on that isn't working properly.
Right, which is, I think, what athletes tend not to do. I think we mainly focus on, we need to just play, we need to just get onto the court. So we try to take these shortcuts to make that happen. And then maybe at the end of the season, we're kind of like, oh, you know what, for the whole season, let's say my Achilles has been hurting, and throughout the season, we've never thought, what is actually the reason why this is happening? So I think that's a great point to kind of take away from this as well.
It might be worth just throwing in a question, I suppose, that the big fear about being told there's an injury is what in an athlete's mind?
Yeah, you've got to sit out. You've got to wait. You've got to take time out.
So sitting out and not playing. But sometimes a little bit of time out at the right time ahead of time might save you a lot more time out later. So I think some of the points we're talking about today, you know, is, I know the fear is being sat out and not competing or not, you know, not performing. So that is always the big fear. But having a frank conversation that gives you that detailed information, I think, to be fair, might maximize your potential, because you're actually acting upon it before, you know, things turn to the point where you really have to take time out.
Exactly, because I know from my experience, every time I've gone to a physio and said this is hurting, the result is sit out for 2 weeks. And in my head, I feel like there's a disconnection between the coach and I. So whereas the coach obviously wants me on the court, whereas I want what's best for myself as well as when I am back to play. So I know that some athletes find it hard to kind of continue where they're at after sitting out for about 2 weeks. So I know I've done it plenty of times, and it actually has made more damage, and I've had to sit out a whole half of a season, let's say, because I didn't want to sit out for 2 weeks.
I think sometimes not getting it checked doesn't mean there's more damage, but your body's getting out of condition, your muscles are tightening, and the balance, that fine flow that you've developed, is being destroyed. You know, that kind of, that balance where the way the muscles are firing, the chain reaction, if you like, the activation sequence in the muscles is being lost. And with something where there's accuracy involved, like, you know, shooting the ball, for example, particularly, or where there's some other accuracy involved in the sport, that's where you can get that chain that gets broken down, and that actually kind of really changes the way your whole body integrates with performing at a high level, and accuracy particularly. So I think the thing about timeouts is rest on its own without really understanding what the problem is or having an accurate diagnosis doesn't actually help the situation, because you're losing fitness, and actually you're not necessarily fixing those imbalances that have caused the injury or the timeout. So,
yeah.
It's frustrating, I know. And I think erring on the side of caution, if people aren't certain when they get their professional to look at them, they will tend to say, sit out, because of course, quite often that might relieve the symptoms. But to me, that's a little bit of a soft touch approach to really understanding the athlete's needs and problems. But
right, exactly.
That's how it can.
Yeah. So I know with some of the injuries that I've had, it usually hurts to touch. However, I've gone to loads of different physios throughout my career, and sometimes they actually push on where it hurts to kind of get, let's say, the flow. Is that actually the right action to take? Because it seems mind-boggling to me how if something hurts, you kind of dig at it.
Okay, well, I think from my perspective, osteopathically, what I always do is I always look sort of at the area around, either side of, or deeper or superficial from where the actual point of pain or injury appears to be. Because if you work in towards the point of injury, you start to rehabilitate everything around it, and actually that takes off the pressure and resets that fine balance we've been talking about, which then allows you to get in finally into the bit where the pain is. So the idea is not, the way I'm thinking and the way I'm working is actually to provoke aggravating that tissue. It's more to activate the tissues around, the muscles around, to work better to support the bit that's actually got the issue. Yeah. Now, there are times when there is a tear and there is actual damage, but the process isn't dissimilar in a sense. You still don't want to traumatize the bit that might eventually need an injection, might eventually need other interventions. But whilst you're waiting and thinking about that, you may as well start working in that sort of targeted level round and towards, because you might actually find over that process things are getting better and better at a faster and faster rate. So whatever the outcome is, you're rehabilitated or prehabilitated, ready for any other intervention, so that whatever might come, you're still in better shape than you would have been just by sitting there doing nothing. At the worst case.
Right.
At the best case, you might actually be better in full action and trust your body a bit more to continue with the rehab or remedial exercise before you return to full activity.
Right.
So there are strategies, I think, but it needs thinking through, and it's not just a one size fits all. You've got to look at each individual.
Yeah, everyone's body is different as well. Yeah, that makes complete sense. What is the right way to warm up? So I've been on thousands of teams, and the warm up is always completely different. My last team that I was with, we did a lot of activation stuff, and for me that helped and it didn't help. I felt very tired before going into practice. I know when I was younger, I would just go straight into practice without an actual proper warm-up, and I kind of felt better. Is the correct way to kind of warm up?
If you're training quite intensively and on a frequent daily or every other day basis, you are picking up tension that you don't end up allowing your body to recover from within the 24 hours. And that, as you get older, goes on for longer. Yeah. So you need to go into each new training session not feeling great and raring to go. That's fine in the head, but you need to be mindful of the fact that you need to allow your body to get to trust itself and to get your mind and body to work together in harmony again, because that doesn't come instantly. And what happens when you're under pressure, when you're actually performing at a high level, is you don't want to keep thinking. You go onto autopilot to do what you're doing, don't you? Because you're trained. Yeah, you don't have to think about it. So training, and the training and stretch sessions, is about the mindfulness of getting to rely on your body. And so doing activation stretches and functional movements is a good thing to do, but it's probably good to do it not just as a warm-up. It's probably good to make that your main program in between all training days.
Okay.
Yeah, it's almost not enough just to do it just before you start. I'm not saying it's not good to do it before you start on that basis. Pure stretching when you're cold or going straight in often can create injury, and it's a fine line between doing the exercise or stretches too strongly because you're feeling okay, and actually causing or predisposing injury for later on when you're actually playing. So I think sometimes what we do is training people how to stretch properly is actually look at them individually, look where the blocks are, and look at how they might do, say, a quad stretch or a hamstring stretch, and how they could modify it to suit themselves exactly. And also, even though they're stretching their leg in those two exercises, have a look higher up and see whether their spine, or their shoulder is actually causing tension spread, which is affecting the way that hip is moving. And often I find that in people who play lots of sport regularly or the same things regularly, that's often the place to start, is to, goodness me, you wouldn't believe it, but it's to stretch the chest or to stretch the abdominal wall or to stretch something far away to relieve the tension on the bit that keeps creating the problem. So it's getting a bespoke program you can do at home on your own is good. And actually doing this muscle activation isn't a bad thing, but you probably need to do a little more of that on a regular basis to make it really valid just before you play. Otherwise it's new.
And I think that's the hardest thing that I've kind of had the strength to do, is to tell a physio, tell a coach, I have my own warm-up. This is kind of what I would like to do. But being in a team sport, the coaches like everyone to do the same thing. And I think it is very, like you said, it can create more damage than good. So just to point out
I'm sure it's not easy managing a whole team of different people, different bodies, different expectations. You know, it is. I'm sure it's a hard job, and it is a hard job. It's not something I do, luckily. In a sense, I'm looking at individuals, but there is a kind of common ground between, I think, what a coach might inspire in the team and what the team might need individually. And there's a mix of the two that needs to be brought into play, because it can't be one size fits all. Even though you're all playing the same game at a similar standard, that isn't all about the rest of your lifestyle either.
Exactly.
You know, I think you probably, I mean, in terms of the day jobs, you know, most people are doing something else. They're not just doing their sport unless they are paid at professional level. And if they're sitting at a computer or doing other things, which many people do, there's a lot of kind of demand change between doing that and doing high level sport. And I get it, it's a challenge. It really is difficult. So, but as I say, bespoke stretching, assessment, finding out where the blocks are and barriers are in one's own particular body is the way I advocate preventing injury and getting better performance. It really, that goes together. Does that help a little bit?
No, it does. So my final question, to go back to the mindset and having your mind trust your body, I kind of wanted to touch on that as well, because I know that a lot of people have injuries, but they're scared to then do certain things just in case that injury comes back. So for example, for me, I rolled my ankle pretty bad, and I didn't want to kind of go in to where there's lots of people just in case I step on someone's foot again and roll it again. How, if you can anyway, give any advice on how we can get mentally prepared and mentally stable to allow us to go back to how we were?
Research said, and I taught a whole course actually on this injury prevention some time ago, and actually, I mean, many athletes, most of the research is about lower limb injury, because actually that's the most common research that's easy to do relatively. So in football and all sorts of other sports, the knees, the ankles, they're the common place to get injuries most often. So there's plenty of research on it, but still, how you kind of get the mindset right. What the research also said is that beginning of season or after an injury is your most likely time to injure yourself again. Yeah, the first time back, you know, because one is in the head, not prepared, and confidence may or may not be correlated to the actual weakness in your body. So what we do with some tests is I use a set of various weight-bearing tests squats and lunges, but assessed on a particular benchmark model. So what I look at is with your injury, how are you actually able to weight bear doing an increasing set of slightly more awkward, slightly more balanced, looking for your coordination, looking for your control, looking for your fatigue through different ranges of movement to see really where you start to falter. Yeah, that may not be pain, but it's where you start to feel not quite right. And then we look at what the components are around that might be driving it. So, and then we say, well, look, if I can go through a full range of tests with you, and put quite a reasonable amount of stress, it's not a full game, but it's still a certain amount of stress on you to actually see how you're physically performing, then I can see that you might be, say, overcompensating more than you need to. And actually your body's behaving like it's recently injured when it isn't. So the way it looks, it shows you're holding the injury in your mind and it's reflected in your body, if that makes sense. So what we need to do is look at those imbalances and try and restore your confidence. So you're using, say, both limbs evenly again, both knees evenly again. And once we get that evenness back, we need to give you exercise to actually not strengthen and work on the injured side, but sometimes to work on the opposite side of your body to actually improve the way that's helping you get your balance back. Okay, so that's the kind of way. So once you've then got your balance and coordination back and you've gone through these processes of kind of building up your strength, you then do need to try out and actually see with a bit more confidence then what you should be able to achieve. And you need to do some practice sessions and you need to do some shorter sort of workouts in a sense within the frame to see what you can do to get confidence back. It has to be confidence and it has to be done in that manner. And then we review again, once you've played a couple of times, what's your body picked up from that more high intense exercise. So what happens is you pop back, we have a look at how you're working again. I'm saying, well, compared to before, your weight bearing much more evenly than you were before. So you've actually started to improve your reliance on your body and it's going in the right direction. If we see it's going still more in the wrong direction, not just because of pain, but because of what we can see, that might mean we need a further investigation to say, well, we need an x-ray or a scan, or you need further investigation to see if there's something still underlying that isn't resolving.
Right.
Does that make sense?
Yeah, that makes sense. Sorry, just one more question. So after recovering from an injury and we go back to playing, do you advise, because I know there's some players that will play the whole game or match, do you kind of advise us not to do that, but to limit our time on the pitch or the court?
What I was saying just now is exactly that, getting your confidence, You want to get your confidence measuring the intensity you're playing at, and I sometimes get people to score how they were performing, and I might say, well, I was doing about 8 out of 10, today. It wasn't 100%, it was 8 out of 10. And then we get them to score, for example, when the pain came in, at what stage during their play. So in the beginning, it might be you've been playing 25 minutes, and that's when it begins. You might measure that during the next 5 minutes, it actually gets better again and goes away, or escalates and keeps climbing. And if it starts to keep climbing at that point, but it takes 25 minutes, say, to come on in this example, that tells me there's a fatigue component to this coming in. Whereas if it comes on much earlier, let's say after a minute or 5 minutes, that means quite different things about the way your body's working. So there are some questions to ask to work out. So I have to work with someone to say, well, how's the training going? We break all that down in the questions when we see them again and actually work out from that what maybe the likelihood is of going back more strongly into things, or they need to backstep a little bit and let's review the training or the rehab. That's the method. So you're not left sort of throwing yourself in the deep end.
Which is what we tend to do.
Well, I think going in the deep end, can be a very risky way of doing things. But I know when teams are demanding and you need to be in there, I get it. But, there is a point where you need to look carefully at that supporting way of going back into things. So you're not actually doing it completely blind. That could be dangerous.
Yeah, exactly. I was watching this movie or episodes called The Last Dance, and it's about Michael Jordan and when he was playing in the 90s and he hurt himself, and the team literally said, every game you've got to play about, I think it was 14 or 7 minutes, I can't remember which one. And even though he felt fine, the team was like, no, you still got to wait, you have to wait. So that's why I kind of asked that, because it's either we're very limited or we're just thrown into the deep end. But yeah, you've answered that.
There is a bit of less deep water and there's not sitting out. Yeah, there's a bit of work to be done in the middle that's constructive, you know, not just waiting, because waiting and doing nothing is not actually productive at all. It's
Right.
losing your fitness and it's not moving forwards, and you're not learning anything more about the injury.
Exactly.
You know? So my sort of way of thinking is this kind of coached process through and supporting process in recovery is really important to have those touch points to come back to. You know, and that's the kind of thing we try and offer with people. We're trying to offer, you know, people from the program you've been on as well, because I think that's the missing gap sometimes for many people.
Yeah. All right. Thank you very much for answering my questions.
You got a few bits of information there that might be useful, at least.
Yeah. No. Definitely. Yeah.
Great. Well, I look forward to talking to you again soon, and have a good day. And yeah, we'll speak later in the week.
Yeah. Thank you.